In this episode of the Brain Surgeons vlog, I'm going to be talking to you a bit about CT scanners, why they're important for neurosurgery, and how they work with the help of some fantastic art by Louis from ladvik.com. We're bringing you this next episode of the Brain Surgeons vlog live from a CT scanner at the Royal London Hospital. And this is one of the A&E CT scanners that's used for traumas predominantly, strokes, and really bad head injuries. Before we talk about how CT scanners work, we need to talk a bit about X-rays. The way that we see things as human beings is that light bounces off objects and is reflected into our eyes, and that's how we see. There's a whole other layer of waves called X-rays, and these are rays that we can't see with the human eye. They can pass through soft tissues in the body, and we can use that to our advantage. If we shine an X-ray through somebody's body, it's going to pass through things like the lungs, where there's nothing dense or thick that's going to absorb those X-rays. And we can catch those on the other side of the body with a film that will catch the X-rays. Things like the bones and slightly more dense tissues in the body will absorb some of those X-rays, and they won't be caught on the film. And that way we can see things such as bone, heart shadows, lung field. The best way to look at the brain and the spine, especially in emergencies, is with a CT scan. A CT scanner works by passing lots and lots of X-rays through the human body. So a patient is transferred onto the trolley, which is then passed through the CT scanner. As they're passing through the CT scanning tube, this is spinning around the patient and firing X-rays through. These X-rays are then detected on the other side of the patient, and these images are then passed to a computer and compiled into a 3D image. If we need more information about more minute structures or things like blood vessels in the brain and in the spine, then we can give something called contrast. That's injected through a vein, and that will light up every blood vessel in the patient's body. We can use that to our advantage to look at the blood vessels in a patient's brain and spine. And in certain circumstances, like certain brain tumours for example, the tumour will take up some of that contrast and really give us a lot more information about what we're dealing with. So thanks a lot for watching this episode of the Brain Surgeons vlog, and that was all about CT scanners. If you're enjoying these vlogs and you want to see more, like, share and subscribe to us on YouTube. We'd really appreciate it. Come on guys. Hi from all the radiographers at the Royal London. Say hey! See you later.